Hello, it's Dr. Scott Harrington with Vegan Primary Care Live. Hello, everybody. Welcome to Vegan Primary Care Live. This is Dr. Scott Harrington coming to you live from my virtual doctor's office, where you can see a vegan doctor as your primary care doctor virtually from most U.S. states. Not just for a one-time consult, but as your primary care doctor, someone who gets you and can be your health advocate. Because I'm licensed in most U.S. states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. Even if you haven't adopted a plant-based diet yet, you're still welcome to be my patient. But beware, diet and exercise and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health, and we will work together to help you get off chronic medications through a healthy lifestyle. Before we start, I'd like to invite you, if you haven't already, to explore the benefits of seeing your doctor virtually through telemedicine. Once you've had a virtual visit, it's hard to imagine going back to a regular doctor visit. With virtual visits, you never leave the comfort of your own home, no sitting in traffic or running late, no waiting rooms. It's the future of medicine. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay. We're live streaming to multiple platforms and ready to take your questions. Okay, what I'm going to do right now is I'm going to send out a StreamYard invite onto the chat stream. So if you're really interested, we could try to work out where you get on and you show up personally in my live feed. So that would be kind of cool. But right now, what I'm going to go ahead and do is answer a question that I got before the visit. I had a question from someone who said, my pediatrician is recommending, now that my child is over 1 year old, they are recommending cow's milk. And I'm a vegan and I don't recommend cow's milk. Do I have to give my child cow's milk? And the answer is certainly not. Certainly not. We know, it's standard knowledge that all doctors know that before age of 1, that the cow's milk can irritate the brush border of the intestines and can cause microscopic bleeding and anemia in infants. And so it is a little bit weird after age of 1 for people to feel all of a sudden comfortable with the idea of giving their child something that could irritate the brush border before age 1. And so I find it was something that I was having cognitive dissonance about as well before I became a vegan. I recommend it as well, but it's well-minded. What the doctor is trying to suggest is that when infants become 1 year old, they are and parents are starting to wean off of breast milk and formula. There is still a high need for a high calorie dense diet, because a plant-based diet is a low calorie density diet, and it's really good for adults and kids too, but you don't gain a lot of weight as an adult, and you can maintain a high volume of food and feel full with a low calorie density. But for small children who aren't are picky eaters and stuff like that, you have to have a high calorie density so that they continue to maintain their growth and they don't go cross growth lines, and they're developing regularly. So in this case, you want to have some form of supplement in their diet, and it comes in the form of milk. And because you're vegan, we recommend plant milks. And the number one plant milk that has the most physiologic comparison to regular milk is soy milk. Organic unsweetened soy milk has the most, the macros are closest to human breast milk. So that's what I recommend. So you don't have to switch to cow's milk, just drink soy milk. Along with, breastfeeding, and as breastfeeding is waning down, you can use soy milk more and more. And as the child will start to increase the other foods in the diet that are appropriate. Okay, here. So we've got several questions. So I'm going up to the top. All right. Okay. So Purnima says, explain vegan, as it is confusing to me, as I find tons of students who say they are vegan. All right, Purnima. So this is vegan primary care. What is veganism? Veganism is where you consume no animal products, no meat, cheese, eggs, or fish. There's ethical basis where we don't want to harm animals. There's environmental reasons because the animal industry creates significant damage to the planet. There's reasons for world peace and being able to feed our the world, whereas you need land for raising animals, and you can do so much more raising plants. You can feed more people on a smaller amount of land. And then recently, along with the health benefits of going plant-based and reducing your risk for heart attacks and strokes, and the number one killers of Western diet eating civilization is diet. But recently, the pandemic illness is another reason why people are wanting to go vegan, and that is, with lots of animals and factory farms close together, they are not socially distanced, and it increases a situation that breeds and fosters mutations of various viral illnesses that have plagued us. So many reasons. If you have students that are vegan, they do not eat animals, and they try to avoid wearing animal products and fur and leather and that sort of thing. So good question. All right. Now we have a question from Damien. How do you perform physical exam? Okay, this is a good question. So this is pretty simple. With telemedicine, it's what I can see on video. There's lots of different platforms to do telemedicine on, but Zoom is the one I use, and it's just a Zoom video. And so I can see in your mouth if you want to do an oral exam. If there's irritation to your tonsils, I can see that. Skin exam, just do basic exams. It is hard to do, obviously, a lung exam and a heart exam through telemedicine. These things can be used can be completed through devices called Tyto Care device. It's a device you can buy that can record your heart and record your lungs, and you can send it to your doctor so that they can see it through telemedicine. So there are certain exams that you just can't do, like a pelvic exam for females. So telemedicine doctors recommend that patients who require procedure-based specialties have those doctors. But for the most part, most primary care can be done through telemedicine. Thanks, Damien. All right. All right. Purnima suggests, so is vegan the same as vegetarian in my country? And the answer is that, as far as I understand, vegetarian could also mean that people consume foods where the animal isn't killed, like milk and eggs and that sort of thing, where vegan is completely without animal products. All right. So just going down here. Da, 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 da. All right. Okay. All right. Diana says dairy is so inflammatory and casein is carcinogenic. Yes, yes, I will agree with that. All right. We have a word from our sponsor.
Impossible Burger is a good event.
Okay. All right. The question is, Impossible Burger, is it good or bad? Okay, so I answered this question recently. Impossible Burger, you have to think, the question is, in something nutrition-wise, is something good or bad is not the right question. The right question is it better? Is it better than something else? Because everything is relative. Is it better than kale? No, no, kale is much healthier for you than an Impossible Burger. But is it better than a meat burger, a beef burger? And some of the aspects of the Impossible Burger are worse, actually. Like it actually has a higher saturated fat content by 1 or 2 grams per 4-ounce patty. But it is not coming from an animal, so you're not getting those meat proteins. And when studied in whether you reduce animal proteins with plant proteins and replace them with plant proteins, that you have higher health benefits. You see benefits in this scenario. So when you put them head to head, the Impossible Burger is much healthier for you because it doesn't contain meat, and cholesterol, and that sort of thing. Okay. Okay. All right. Purnima suggests, how about almonds? Is it because nut allergies that we avoid that? Well, in terms of the plant-based milk concern, I'm looking here at a chart that shows the macros of different plant milks. And it's actually almond milk has 74% of the calories from almond milk come from fat, whereas in soy it's 30%. And that's closer to the breast milk, which is 54%. And so a lot of times the almond milks are sweetened, and they only have 13% of the calories from carbs. So the recommendation is soy because it has a macronutrient profile that is closer to breast milk. Okay. Okay, so we have Damon. Damien, how do you make a referral to see a specialist? So when you work with me and other primary care doctors, we put in a referral and we fax it to the recommended specialist, and then they provide us the feedback from the visit. And so it's nice to have a primary care doctor because they can be your home base. You may see several specialists, and the right hand is not talking to the left. And so that's the point of having a primary care specialist, an advocate, a health advocate who can translate the medicalese from all the different specialties. And sometimes you'll get a medicine prescribed from one specialist that interacts with a medicine from another specialist. And so that's why it helps to have sort of an expert primary care physician. Okay, forgive me as I'm scrolling through these. All right, Sherry, what about soy allergy? What milk would you recommend as a second choice? I think almond is a reasonable second choice. There is a plant-based pediatrician. Her name is Jackie Bussey, and on her website, she has some information about plant-based milks. And so you can look at that. But the key is that it's unsweetened, and that organic is best. Some folks in my family, after their child was off of breast milk, they used almond milk because their child was highly constipated. And once they switched to almond milk as a supplement to their normal diet, their constipation went away. And so almond milk is definitely something that you can use as long as it's not the only food that your child is getting. If your child is getting only breast milk or formula, total only milk, it needs to be formula or breast milk. Thanks, Sherry. Okay. Okay, so we have Kim Howell. Do you have an online account per patient so that they can log in and keep track of their results? Absolutely, absolutely. Kim, so Kim's question was, what about how does it work? Basically, how does it work with primary care through vegan primary care? And the answer is each patient is assigned a medical record, and you get a login and you sign in, and everything that's done through telemedicine, you can have access to all of your records. Any kind of labs that have done through Quest or LabCorp get put into the electronic medical record, and you have access to that online. So it's really nice. Also, you can get records from prior physicians, and you can get it sent to your electronic medical record. Anytime you send anything to the fax number on the website, the fax number of our office, then you will get it sent directly into your chart. We'll give you that fax number. I'll put it in the comments here. The fax number for the, oh, here it is. Okay, I'll put it in there in a second. Okay. What is your perspective on blue-green algae, especially the DHA and EPA? How does osteoarthritis affect vegan nutrition lifestyle? Thank you in advance. Okay. So Damon. Okay, so the first question is about blue-green algae. And so I'll talk about blue-green algae now. And the concern for blue-green algae and other algae products is, as far as I know, blue-green algae is safe to consume, whereas when you compare it to spirulina, which is spirulina blue-green algae. I'm asking the internet here. Is a naturally occurring blue-green algae. All right. So I'm concerned about spirulina and blue-green algae because of the fact that it is an analog. It looks very much like B12 in the body. And when you consume it, there's concern that it sits on B12, the receptors that B12 will affect, and make it hard for your body to utilize the B12 that it has. So spirulina is a well-known supplement because it has lots of nutrients, and it's green, so people are like, oh man, this is a green powder I can add to things. But there is a concern about spirulina, and with B12 is a problem in vegans. So I recommend taking B12, 500 micrograms a day, and not to consume spirulina or other blue-green algae. All right. Okay, so we have a question from Diana. Or she has a statement about phytoestrogens. Mammalian estrogen is present in animal flesh and secretion is cancer promoting. That is correct. It's correct. So what we're having is people commenting on other people's questions. And so this brings up the question about soy. Is soy safe? Soy contains phytoestrogens. And these estrogens, chemically somewhat similar to estrogen, but as right now we know that they have many beneficial effects. Like they will affect the estrogen-like receptors without increasing your cancer risk, and help with hot flashes. They've been studied in hot flashes, and so they have a lot of benefits. Some folks, there's even a concern or even a suggestion they may help with bone density, or that's some of the things that they are consumed for. One of the concerns they have is, like, because they're a phytoestrogen, because they're very similar to estrogen, does it increase your risk for breast cancer? And the answer is no. It actually is protective against breast cancer and breast cancer recurrence. And the Japanese who consume the highest amount of soy products can tend to have a lower rates of of estrogen responsive cancers. So that is something that needs to be sung from the mountaintop. Soon we're going to have a soy article that we're producing and going to be sharing around. So check it out. Okay. Okay, so Purnima suggests, hey, what about seaweed and other plant-based products and plankton from the oceans and seas? So one of the things that is helpful for this types of food are the iodine that you get, And certain foods like nori and wakame, that's in seaweed salad, nori, the stuff that's wrapped in sushi, contains reasonable amounts of iodine. They're not too high. Things like kelp and foods like that might be so high that it can cause problems with iodine. So in this instance, these foods are safe and effective, but as far as I know, they do not cause the problems with the spirulina that the spirulina causes, being a B12 analog. Okay. All right, a little word from our sponsor. Okay. All right. Our sponsor reports. What about different states? What about the different states? So I am a telemedicine provider and I have licenses in many states. And if you live in Michigan or Alaska or Hawaii or Florida, you can be seen by Dr. Scott Harrington. I have licenses in over 42 states. So check the website and see if your state is there or not. If you would like to be seen by me as a patient, then certainly I grew up in Florida, and Florida is my home state, so I have a license in Florida. I know there's a question about Florida. And so you don't have to live in Florida to be seen by Vegan Primary Care. So you simply go onto the front page, veganprimarycare.com, make an appointment, and can be seen. Even if you live in Nebraska or Alaska or Hawaii or all those states out west. Okay, so let's see. What's the next question? Okay, so the question is about the state of Virginia. Am I licensed in Virginia? And I think the answer is no, unfortunately. I'm going to double check that. Okay. Is Dr. Harrington licensed in Virginia? No. Unfortunately, folks from Virginia, I cannot be your primary care provider. Okay. All right. So I'm pulling up some other questions that have come up recently, and some of the other questions are about. People have asked about other medications for coronavirus. I know there are monoclonal antibodies and these kind of medicines, but what about outpatient? And right now, there are no other FDA-approved medications for outpatient treatment of coronavirus. There have been things that have come up like hydrochloroquine, and we learned that medicine was not helpful and harmful even. So there are other medicines that have had a lot of buzz lately, and so a lot of patients are asking me about them. One of them is something called Flavoxamine. Flavoxamine is a medication that is for obsessive compulsive disorder, but upon researching it and repurposing it for coronavirus, they found that it decreased the cytokine storm that happens at 7 to 10 days. Where the immune system is going haywire. It settles that down. The problem with Flavoxamine is that, and other people who start antidepressant medicines will know that it can cause headache and it can cause nausea when you're starting this medicine. So that limits it. Another medicine that has become very popular as a potential treatment for coronavirus is Ivermectin, and you'll see that this medicine being touted as a potential treatment. And the preliminary studies for Ivermectin have been mixed at times, but good in others. And sometimes they're even used in a population-based programs in other countries outside the United States. Peru is one that has used it extensively, and there have been some cases where there was an outbreak in a nursing home where people had scabies and were treated with ivermectin, which is a parasitic medication, and they had very low cases, very low rates of coronavirus. So the National Institutes of Health in January 14th, they changed their do not treat with ivermectin recommendation to ivermectin we cannot recommend for or against. So that's actually a big shift. And so it's given providers the opportunity to try to make the decision up for themselves if it's reasonable and if it's not going to cause harm. And so in this case, patients who have been positive for COVID have called in, and I have provided, if it made sense, these types of medications to patients if it made sense. If there were no side effects that they were going to likely experience that would be dangerous. Okay. So Susan Kioe says, can soy cause thyroid problems? Okay. So I haven't heard of soy causing thyroid problems. I haven't heard of that. I've heard of certain things causing problems with absorption of iodine or being goitrogens, which are things like the cruciferous vegetables. So as vegans, I recommend that people get lots of cruciferous vegetables, at least one serving a day. And so if you don't use iodized salt or you don't supplement with iodine or eat sea vegetables, then you may want to take an iodine supplement of 150 micrograms per day. Okay, so we've got a word from our sponsor. 1 second. What's this? Okay. All right. My sponsor is telling me that we're getting close to the end of the visit here. All right. So I did want to mention that. All right. Okay. One last question before I leave. It's from Richard Hubbard. What is the most vegan-friendly coronavirus vaccine? I'll put the question up right here. What is the most vegan-friendly coronavirus vaccine? And as far as I know, the vaccines, unfortunately, with medicine, a lot of things are tested on animals, and it's awful. That's awful. And this is getting better. This is getting better over time. They're coming up with models where they can do things with virtual models or the organ models on chips. They call them chips, but they're organ tissue models. And so I don't know the answer to that. I don't know which one is the most vegan friendly, but I know that this vaccine, these new vaccines, these mRNA vaccines are not made in the traditional method that they make the flu vaccine, or methods that use eggs and this sort of thing. So as far as I know, these are probably the most vegan type of vaccines that have been made to date, but I don't know which one is the most vegan. I recommend the coronavirus vaccine that is available to you is the one that you take. And so that is my recommendation. I'm not an anti-vaxxer in this scenario or any scenario. I'm in the military and we're big on vaccinations, and they're like modern miracles. And so as far as I'm concerned, I recommend vaccination for prevention. If you get a vaccine, you're going to get much less of the viral genetic code than if you get the virus. So the assumption is that you're going to react much more to the virus than you would the vaccine. And with the pandemic surrounding us, you're either going to get the vaccine or you're going to get the virus. So that's what I recommend. And that is going to be our time, you guys. So thank you for participating in this live event with me, Dr. Scott Harrington in Vegan Primary Care. I look forward to doing a weekly broadcast to answer your questions Once again, thank you for your questions, and I look forward to seeing you next week. Bye-bye now.